Hello and welcome back to my channel. Today we're going to cover an important and empowering topic, contraception options. Whether you're considering birth control for the first time or thinking about switching methods, understanding the range of options available, along with their benefits and risks, can help you make an informed decision that suits your lifestyle. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Let's start with why contraception is so essential. For many people, birth control is about more than just preventing pregnancy. It can help manage menstrual cycles, reduce symptoms of conditions like polycystic ovary syndrome or endometriosis, and even lower the risk of certain cancers. That said, choosing the right method is a personal decision that depends on your health, preferences, and reproductive plans. We'll break down each of the categories of contraception so you know what to expect. One of the most widely used forms of contraception is hormonal birth control, which includes the pill, patch, ring, injection, and implant. These methods work by preventing ovulation, thickening cervical mucus to block sperm, and thinning the uterine lining to make implantation less likely. The birth control pill is incredibly popular, and for good reason. Taken daily, it's over 99% effective with perfect use, though with typical use, that effectiveness drops slightly due to missed or late pills. One major benefit is that the pill can regulate periods, reduce menstrual cramps, and even improve acne. Some pills contain a combination of estrogen and progestin, while others, known as the mini pill, contain only progestin, which may be a safer choice for people who can't take estrogen due to a history of blood clots, migraines with aura, or certain cancers. The risks of the pill are relatively low for most people, but they're important to understand. Side effects can include nausea, breast tenderness, and spotting between periods, especially in the first few months. There's also a slightly increased risk of blood clots, stroke, and heart attack, particularly in smokers over the age of 35. But for many, the benefits far outweigh these risks, especially when the pill is used not just for contraception, but for managing heavy periods, endometriosis, or hormone-related mood swings. Next up is the contraceptive patch and the vaginal ring, which works similarly to the pill but with less daily maintenance. The patch is worn on the skin and changed weekly, while the ring is inserted into the vagina and left in place for 3 weeks at a time. These methods are just as effective as the pill, with the added convenience of fewer dosing reminders. The risks and side effects are similar as well, though some people may experience skin irritation with the patch or vaginal discomfort with the ring. For those who prefer even longer-acting options, the contraceptive injection, known as Depo-Provera, offers protection for 3 months at a time. This method is highly effective and it doesn't require daily or weekly attention. Many people find that their periods become lighter or stop altogether after a few months of use. However, it's worth noting that Depo-Provera is associated with a temporary decrease in bone density, which usually reverses after discontinuation. Weight gain, mood changes, and delayed return to fertility are also potential concerns, so it's not the right choice for everyone. One of the most convenient hormonal methods is the contraceptive implant, a small rod inserted under the skin of the upper arm that provides protection for up to 3 years. It's over 99% effective and completely reversible. The most common side effect is irregular bleeding, which may settle down over time, though for some, the unpredictability of the cycle is a drawback. Now, let's talk about intrauterine devices, or IUDs, which are among the most effective forms of reversible contraception. There are 2 main types, hormonal and copper. Hormonal IUDs, like Mirena or Kyleena, release a small amount of progestin into the uterus, providing protection for 3 to 8 years, depending on the brand. They're incredibly effective with less than 1% failure rate. Most people experience lighter periods, and for some, periods stop altogether. The insertion process can be uncomfortable, but once in place, hormonal IUDs offer a set-it-and-forget-it approach to birth control. The copper IUD, known as Paragard, works differently. It's hormone-free and relies on copper to create an inflammatory reaction in the uterus that's toxic to sperm. It lasts up to 10 years and can also be used as emergency contraception if inserted within 5 days after unprotected sex. The main downside of the copper IUD is that it can cause heavier, longer periods, especially in the first few months. But for those who want a highly effective hormone-free method, it's a great option. For people looking for contraception that requires even less long-term commitment, there are barrier methods like condoms, diaphragms, and cervical caps. Condoms, both male and female, are unique in that they provide protection against sexually transmitted infections as well as pregnancy. They're most effective when used correctly every time, but with typical use, their failure rate is higher than that of hormonal or long-acting methods. Diaphragms and cervical caps are silicone barriers that cover the cervix to prevent sperm from entering the uterus. They must be used with spermicide to be effective and require some comfort with insertion and removal. These methods are less commonly used today, in part because they have lower effectiveness rates compared to other options, but for people who prefer non-hormonal contraception, they're worth considering. There are also permanent contraception options for those who are certain they don't want to have children anymore. For women, this usually means tubal ligation, where the fallopian tubes are cut or blocked to prevent eggs from reaching the uterus. It's a highly effective one-time procedure, though it's important to consider it irreversible, even though reversal surgeries are sometimes possible. For men, a vasectomy offers a permanent solution to contraception with a simple outpatient procedure. Vasectomy is safer, quicker, and less invasive than tubal ligation, with a very high success rate. Of course, no conversation about contraception would be complete without mentioning emergency contraception, such as the morning after pill. This isn't a regular birth control method, but an important backup option if contraception fails or isn't used. Plan B and similar levonorgestrel-based pills are most effective when taken within 72 hours of unprotected sex, while Ella, which uses ulipristal acetate, can be effective up to 5 days after. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, when weighing the risks and benefits of contraception, it's essential to consider not only the physical side effects but also how the method fits into your lifestyle. For some, the convenience of a long-acting reversible method like an IUD or implant makes it an easy choice, while others prefer the control of a daily pill or the hormone-free reliability of a copper IUD or barrier method. It's also worth mentioning that contraception isn't just a woman's responsibility. Conversations about family planning, sexual health, and shared contraceptive choices can strengthen relationships and ensure that both partners are comfortable and informed. Thank you for watching. As always, take care of yourself and make the most of your day.